Good evening, everyone, and welcome to the 22nd day of ProVision 2020, a webinar series. Firstly, I would like to welcome Reverend Father Roshan Krasta, Administrator, Father Muller Homoeopathic Medical College, Principal Dr. Shivaprasad K, and Vice Principal Dr. ESJ Prabhukiran to today's session. I welcome today's spokesperson and my teacher, Dr. T. Ajayan, Professor, Department of Practice of Medicine, Professor and HOD, Department of Practice of Medicine, Sarada Krishna Homoeopathic Medical College, Kulasekharam. It's our pleasure to hear you in today's session on utility of physical examination in rational healing. Welcome, sir. I welcome today's moderator, Dr. Rajachandra, Associate Professor, Department of Practice of Medicine, to this program. Also, I would like to extend a warm welcome to all the staff of Father Muller Homoeopathic Medical College, all the doctors, students, and other participants. Welcome you all to the live webinar session. Now, I would like to invite Dr. Rajachandra to introduce our today's spokesperson, Dr. T. Ajayan. Over to you, sir.
Thank you, Dr. Ash. Good evening, all of you. It is my proud pleasure first to introduce about this day. So today we are having a session which highlights on the importance of physical examination. I think all of us are very sure that physical examination is something that actually makes us stand as a physician. Everybody talks about the touch of the doctor. It is the touch of the doctor which is proportional to our physical examination skills. Today, many advancements have reached the medical fraternity. Like, for example, you don't have to use your stethoscope. Everything can be done with the help of an echocardiogram. You don't have to even palpate or percuss because the x-rays can do everything. But it is always what the patients experience, that is the touch, that is always remaining in their hearts. That is through this art of physical examination. As we already know that the physical examination has begun with the invention of percussion technique by Von Brewer. I was so surprised to hear about the story, how he introduced this. I always explain this to my students. Similarly, in the year 1816, when Lennox Bruman first introduced the stethoscope, there is again a story behind that. So these stories actually keeps us motivated, how difficult and how ingenious methods these people have created those techniques, and they have become a source of diagnosis for so many years before the advent of those modern investigations. And I can never take the importance of Sir Hutchison. I always introduce this particular aphorism which is mentioned in his preface, which says that from inability to let well alone, from too much zeal for new and contempt for old. There is a big aphorism, but I would like to put this particular word more important today, that is putting knowledge before wisdom. And it ends by saying, good Lord, deliver us. It shows that extreme sensitivity of a man who talks about don't give importance to the new things. Old things also matter. At the same time, he also puts here saying that knowledge may be important, but more important than knowledge is the wisdom. So I'm very, very happy that we are having a session, particularly a classified session on physical examination today. And for this right topic, we have a right person with us, who is none other than Professor Dr. T. Ajayan. So with few words, I would like to introduce Dr. T. Ajayan. Sir is born in Thiruvananthapuram. And when I go through his resume, it was not brief, it was a very elaborate resume. When I went through, I found this personality is an offshoot. Is an offshoot personality linking tradition to modernity. When I see his initial degree, I see he has done his DHMS. And when I see his final degree, it was MD Practice of Medicine. That was a very rare combination. We don't find such people. And his DHMS comes from Sri Vidyadhiraja Homeopathic Medical College, Thiruvananthapuram in the year 1994. Sir has completed his graded BHMS from Government Homeopathic Medical College, Thiruvananthapuram in 2001, and he has completed his MD degree in the subject of practice of medicine from Sarada Krishna Homeopathic Medical College. Currently, Sir is decorating the post of HOD, Head of the Department of Practice of Medicine from the prestigious Sarada Krishna Homeopathic Medical College. He is also the coordinator of the Clinical Skill Lab, in charge of Unit Head 3 in Medicine Unit, and academic in charge for the final BHMS students, and he is also a guide for the postgraduate students. And he also is a well-established practitioner. He is a consultant physician in 2 areas. One is Relife Homeopathic Hospital and Pulari Homeopathic Clinic, both in Trivandrum. He is also UG and PG examiner for various universities. And to his credit, we also have, he's the editor in Scribe. There is a departmental journal which they publish, and he's the editor of that. And I started only counting the number of CME's lectures that sir has presented, because everything, if I start reading, my session will be longer. So I would like to just briefly say here, CME's lectures, presentations, workshop given at local, chapter, national and international meeting, over 14. Just for a credit, few of them I would like to read out. One is X syndrome and its management, utility of nurse repertory, and new trends in pediatric management of respiratory disorders. Few of this, there are more than 14 sir has presented, and is very richly associated with most of the community activities organized by Sarada Krishna Homeopathic Medical College. He also participated in various national and international conferences, over 35 till date. And I had an opportunity to interact with Dr. Ajayan on several occasions, particularly when he was here as an examiner for our postgraduate students, and also in the year 2011 when I visited the Sarada Krishna College for an ROTP program. So it was not actually to say that something just for words, but actually Sarada Krishna Homeopathic Medical College is actually doing a lot of work in the community and also for the students. With these few words, sir, we find it our privilege and we deem it our goodness to hear from you. Sir, the floor is open to you. Kindly start your presentation.
Okay, thank you, sir, for your nice introduction. Okay, let me start my topic, the today's session. Good afternoon to all. Good evening to all. First of all, let me express my sincere thanks to the Father Roshan Crafts, and also extend my sincere thanks to the principal, Dr. Shivaprasad sir, and also extend my thanks to the organizer, the Dr. Dheeraj Fernandez, and so many students also is there, Dr. Ashik, and other respected doctors, my dear PG doctors, interns, and other students, other doctors. Now is an audible, sir? Now is an audible?
Yes, sir.
It's audible.
Okay, okay. Next, this time I would like to express my the heartfelt the congratulations to then this webinar series. So many doctors are presenting their purpose, and really I heartfelt congratulations to the presenters. And also this time utilized for the upcoming presentation. So many doctors are again engaged, and also extend my congratulations. Well, I congratulate everyone. And also this time I use for my academic mentor, Dr. In our college, my principal, Dr. C.K. Mohan sir. I am very much happy to be with you, not as an expert. The expert in this topic, there is an utility of physical examination in rational healing. But the sharing the few moments of my experience with the utility of physical examination in rational healing. The majority of our about then this topic, there is an importance of then physical examination. Maybe the using their on daily practice along with the other techniques, then subjective level symptoms. Through the subjective level symptom, we are collecting the symptoms from the patient. Then successfully we have managed the cases. But as a part of my teaching and practice of medicine, we have to give much importance to diagnostic criteria along with the physical examination and investigation. This time I remember the words of the great philosopher Dr. H.A. Roberts says, the aim of the homeopathic physicians are two. The first one is the diagnosis and second one is the diagnosis of individual. Again, he quoted, they never use our diagnosis for therapeutic purpose. You all know that the practice of medicine deal with the etiology, clinical features, diagnosis, and finally investigation. With the help of we are diagnose the case. After the diagnosis, we are successfully manage the case with the help of general management and medicinal management. For the diagnosis, ever for making individualistic, that means individualistic means the homeopathic diagnosis. Physical examination is very important. The physical examination, not only the pathognomic sign of disease are found out, but certain characteristic sign and modalities of an individual can be identified. Please wait. Then rational medicine. Then here, then I quote the rational. These are reasonable, logical, sensible. That means not influenced by emotions. We are all humans. In our presentation, the very important one is the emotional level presentation. That means if a case we are approached, we are emotionally approached, we are not able to treat successfully with the homeopathy medicine. That means that a case is arrived in near to our side, then first we are able to think, then we are judging. That is very important. With the help of, that is a system based on laws and principles. Homeopathy itself a perfect system because it's based on the specific and particular laws and principles. The laws and principles everybody know. The ideal cure. That's why I quoting the ideal cure for this presentation is very important because we are all are now in lockdowns. Then our state is locked down, our country is locked down, all over the world now in lockdown. Therefore, we are conducting this type of the webinar series. Then I will convey it later. But this time you remember ideal cure, the homeopathic cure made according to the rules that should exhibit the following characteristic. You know, the hearing the beautifully described about the ideal cure. Ideal cure in chronic and acute entirely different. Then everybody aware about the chronic cure. The chronic cure always the center to periphery. Then again, higher important organ to lesser important organ, upward to downwards. These are the qualities, these are the characters we are seeing in the chronic cases. But in acute cases, there is a beautifully described in the life history of hearing. Then only these acute cure characteristics we are seeing in the life history of hearing. It shows the 6 qualities. The first quality is a limitation of unusual course of the disease. Then second one is marked shortening the period of convalescence. There is a question we are raising. Is that the season for the COVID-19? Then nowadays we are heard after 14 days or 21 days, again the same person, the suffering person, the convalescent period is extended. That means they are suffering from the loss of taste, loss of smell, etc. This is our master that clear-cutly says the marked shortening the period of the convalescence is one of the second quality of an acute cure. That means the cure takes place within a very short period. The third point, moderation or prevention of pathological product without crisis. That means the patient then very first is the season for the COVID. Then COVID very first is the running nose. The running nose is there. A patient is reaching our side, never extend the next stage. That is the prevention of pathological product. The never is not affecting our goblet cells. Then our mucinous cells never is unaffected. There is another quality of an acute cure, homeopathic acute cure. And the fourth one, removal of a tendency to reoccurrence of disease and the prophylaxis. That not only for the disease aspect, even the prophylactic treatment also, the clear-cutly we are able to say is an ideal cure, the character of ideal cure. Why? The removal of a tendency to reoccurrence of the disease. The listen here, the latest research of the COVID-19, then it shows asymptomatic cases that antibodies are destroyed within 3 months. The same time, we are also use our prophylactic medicine, arsenicum album 30. That is, the so many studies are showing is long-lastingly the related factors of our immune system is developed. The immune system related factors are developed in our blood after taking the prophylactic treatment of arsenicum album. Our master says, they never repeat the disease, the reoccur the disease in the short interval, the same interval. Is another quality of the character of ideal cure. Then fifth one is rapid recuperation of strength and bodily vigor. That is, we are collectively called it as generals. The generals, the not only physical in mental level generals, physical generals, they are improved. That physical level, that means appetite, thirst, etc. Not only appetite and thirst, even the characteristic symptom of the patient is improved. That is a rapid recuperation of strength and bodily vigor. Then last one is improvement in the mental condition is the first. A mental state, the mental level changes is improved in the first. That means the core of the life, the core of the person is related changes, related symptoms are firstly changed. These are the acute cure, characteristic of acute cure. The essential of cure, I would like to highlighting, then already I convey with you the importance of the diagnosis, the disease diagnosis, and the second part is very important one is individual diagnosis. What is individual diagnosis? A common question is arise. What is individual diagnosis? There's the first one is the naming of the disease, and second one is the naming of a medicine. Ultimately, medicine, then medicine acts as a remedy, that is individual diagnosis. The investigations are also two. The disease investigation, everybody know. The same time, individual investigation. Individual investigation, the hundreds of investigatory procedures are there in our science. The best examples are the Kentian toll observation, one of the individualistic investigation. Suppose a case in our side after treatment, it shows the primary action of a drug, the primary action of a medicine, or a secondary action of a medicine is another individual investigatory procedure. Then remedial reaction of H.A. Robert is another individual investigation. Therefore, a skillful homeopathy doctor, you must be skillful in these two areas, the disease investigation and also you are skillful in individual investigation. But the second one is very tough. The disease investigation, the sophisticated then investigatory procedures are there. Therefore, the first one is now very easy. But the second one, only the skill of a homeopathy doctor is help for individual investigation. And third, very, very important one is the disease management. Then suppose a diabetic case, we are restricted the salt, restricted the sugar. Okay, then as a part of general management. The same time, the individual management means then related to the medicine, you should advise the management. We are collectively, we are call it as diet and regimen. Then homeopathy diagnosis, the diagnostic term are for the sake of brevity, that by Dr. Samuel Hahnemann. These diagnoses become the basis of treatment in modern system of medicine, but such a system cannot be based on a fixed principle. But homeopathic science is based on the fixed principle. Then use of the diagnosis in homeopathy is help for the prognosis and is help for the remedy selection and identifying the miasm. Then identifying the miasm is a tool for the selection of the right medicine. Okay, the miasm also help for the prognosis of the disease, the fate of the disease. Okay. Next, the physical examination. The physical, the diagnosis we are completed in 2 steps. The first step is the clinical diagnosis, and second one is the investigation. Clinical diagnosis means otherwise called it as provisional diagnosis. Provisional diagnosis we are completed, we are collecting the subjective level symptom plus objective level symptom. The subjective level symptoms shows the 4 major components are there. Then sensation, location, modality, concomitant, pathology, etc. Is a subjective level symptom we are collecting from the patient. But at the same time, we are collecting the objective level symptom. The objective level symptom we are collecting through the physical examination. The physical examination procedures are 4: either inspection, palpation, percussion, and auscultation. Then beautifully, while in our introduction, the doctor is beautifully described about the percussion and the auscultation. The invention of auscultation and the story is related to the percussion. It says, okay, then physical examination, the procedures are 4. Then the process by which a medical professional investigate the body of a patient for sign of disease. Then always our individual investigation while observing or while touching or while percussing, or we are place a chest piece over the chest wall. There is an individually investigate of that particular patient. Investigate the body of the patient for the sign of disease. Then here the sign of individual disease. Okay. Then when the physician has finished writing down these particulars, he then make a note of what he himself observed in the patient and ascertain how much of that was peculiar to the patient in this healthy state. That is very important. This time you remember, all the common symptoms are uncommon. All the uncommon symptoms are again common. That is the duty of the physician. A skillful doctor, his or her duty is to work out this common symptom is the peculiar characteristic symptom of this particular patient, or we are misunderstanding this uncommon peculiar symptom is the common symptom of that individual. This differentiation is very, very important. Okay, then here remember the pioneers of physical examination. Then the Hippocrates, then Sydenham's, Andrew Vesalius, then Morgany and Anberger and Lennox. Then contribution of Hippocrates is then father of medicine, the resumption of the human bodies for educational purpose the first time. Then Sydenham, the definition of disease between this is leading to the nosological concept of the disease. This is beautifully described by Sydenham. The Andrews Vesalius, there's an accurate than a human anatomician. The test, he has also published an anatomy test in 1543. Then Morgany, there is an morbid anatomy and pathology as discipline in 1761. Then Anberger, the doctor, our presenter, the introductory speaker, is an already said about Anberger's contribution is a discovery of percussion in 1760 and the dissemination by the conversant in 1808. Then all the listeners are aware about the Lennox. The contribution of Lennox is first then invented the stethoscope in 1860. Then here, that I would like to highlighting that what is the difference between main difference, then allopathy and the homeopathic view on the diagnosis. Then allopathic view on the diagnosis entirely different from our view, the homeopathic view. Then allopathic view, then if you label the disease, if you are not labeled the disease, that means the naming the disease, then not able to write a particular medicine. You are not able to prescribe a medicine. Then the specific drug for each disease, but that the concept is over. Even today, then the modern science, they are believing the symptomatology. For the management of COVID-19, they are not used a specific medicine. They are not able to select a specific medicine. They are used an AIDS medicine, they are malarial medicine, they are used for the management of disease. Why? What is the reason? Again, is highlighting the importance of homeopathic science. We are believing the symptomatology. They are also advised the symptomatological treatment. Then physical examination and investigation for the disease diagnosis, they are used. Then investigation and this physical examination only for the diagnostic purpose. But in this side, in homeopathy side, we are believing the symptomatic treatment. That is, I remember the words of Mathur. The preface is in our written by organon-related preface written by Mathur says the advantage of homeopathic science, the then even the diagnosis is doubtful, we are successfully treated with homeopathy medicine. Again, undiagnosed cases, we are successfully managed with the homeopathy medicine. The listen here, then January, then the outbreak of this COVID-19, within a short period, we are able to select the right prophylactic medicine. The right prophylactic medicine. Why? What is the reason behind it? Because we are believe in the symptomatology. We are not trying for the new medicines for the treatment of or for the management of the COVID-19, for the treatment as well as the prophylactic treatment. Already everything is in our hands. That is the beauty of homeopathy science. Then homeopathy is a remedy for individuals. Then individualizing examination case of a disease. Individualistic physical examination. There is some difference between the general physical examination. We are more and more concentrate to the individualistic physical examination. I will show you number of cases. That time only you are able to understand what is the importance of individualistic physical examination. In allopathy science, if they cannot find any abnormality with the lab investigation or finding, their hands are tied. But our hands are not tied because we are believe in the symptomatology. The need of physical examination homeopathy, we are already conveyed with you. We can treat the patient effectively even before any lab changes are detected. There is another advantage. Then I'll show you a case. Then through this case, just you work out how do you approach a case. Then because in emergency department, the majority of time we are not able to collect the subjective level symptom. Only observational symptoms, only observation objective level symptoms related. We are analyze the case, we are converted in the language of subjective level, and we are select a homeopathy medicine. So just you look this video clipping is an help for you. Please wait. The case of a man in that time for Thomas scale 4. Presenting this presentation. What is this presentation? The detailed case we are discussed later, but just you look what is the presentation. Okay. The patient was very pathetic condition. Then another case, just do a case of appendicitis. There's the doctors are advised an emergency surgery. But we are approved the case, the patient, the presentation is this one, is an help for the selection of the right remedy. Look this case.
ഈ നേരത്തെയും ഇങ്ങനെ തന്നെയാണോ ഈ ഇങ്ങനെ കാല് മടക്കി വെച്ച് കഴിഞ്ഞാൽ ആശ്വാസം?
These presentations is help for the select the right medicine. That medicine that time act as a remedy. Okay, the how can we come to obtain the incorporate into our materia medica these objective level symptom? Then what is there the comparative value for the cure of the sick person? The Hahnemann beautifully describe all these things in different aphorism. I remember the aphorism number 6. I'm not convey with you. Just to go through this aphorism, you are able to work out the importance of physical examination. Aphorism number 6, then aphorism number 83, and footnote of aphorism number 90 is beautifully described. Hahnemann gave the example of observation like what was the color of his face and eyes of the skin generally, etc. Then all these things we are correlated to the materia medica. Again, then very, very important, another aphorism number 211, the Hahnemann refers 3 aspects, that is the importance of mind, the body language, and the role of an observing physician who studies a peculiar sign and utilize it for the sake of the selection of the similema. There are also reminder that there is more in objective symptom than in perceptible to the eye. The subjective, that is a sensation and function of the visibly affected organ, or the part are to be considered as well as the purely objective sign, is the words of another great philosopher, Dr. Stuart Close. Okay, anyway, then our duty is, if in clinically, the clinical presentations, either subjective or the objective level symptom, we are converted to the materia medica language. Then for that, then converted to the materia medica is very difficult. Then materia medica is a symptom register. A well-proved medicine, we are seeing the hundreds pages of symptom. Therefore, all the symptoms are remember or keep it in our brain is very difficult. Therefore, we are depend our repertories. It is impossible to practice homeopathy without the aid of repertories, and the best repertories and fullest. Then I remember that it's very out of this for the physical examination related repertories. Out of this, the very important repertory of the hearing gaining symptom of our materia medica by Calvin B. Nerr. This time I convey the few words about the Calvin B. Nerr or related to this repertory, because in my practice, the now around 40% of cases we are used these repertories. Therefore, I pay my homage to the Calvin B. Nerr. You know that the Nerr was born as the December 1847. Then his contribution, his completed hearing gaining symptom, that after his death in 1895, along with the other two eminent personalities, Charles Moore and Charles Raw. He took 5 years for the completion of this work. This importance of this repertory is under the period, and we are discussed later. Then other textbook shows the related, then our physical examination related rubric and as well as the symptom we have seen in homeopathic medical repertory, Robin Murphy. Then synthesis, we are also Frederick Strand's repertory, synthesis repertory, we are also seeing the number of rubric, the investigation and as well as physical sign related rubrics are there. The repertory of homeopathic materia medica by Dr. J.T. Kent is, and we are widely use this repertory. The majority of homeopaths and throughout the world use this repertory. Then a concise repertory of homeopathic medicine by Dr. Pathak. In importance of Dr. Pathak, then special the diagnostic terms here are used. Then also investigation related rubric also seen this Pathak repertory. The repertory of hearing gaining symptom. I'm not a repertory teacher, but the same time I am attracted this particular repertory, but the study of this repertory or reference of this repertory is too difficult. Therefore, majority of doctors in their practice not use this repertory. But a modified, a reversed edition is now available in the form of our Dr. J.T. Kent method of repertory. Therefore, very easy to reference. Okay, is published in 18 after the death of this 1896. This is a Puritan group of repertory based on hearing gaining symptom. What is the importance of hearing gaining symptom? Almost all the symptoms are proving, reproving, and verification rubrics is enter in this repertory. We are seen in this repertory. The plan and construction is in around 48 chapters and 408 medicine. Based on concomitant, then also included the cured symptom, then pathological and diagnostic names are given to the fullest based on symptom as told by prover and patient and as observed and reported by the physician. The physical examination finding also there is a beauty of this particular repertory. There's so many physical examination rubric we are seeing in this repertory. There inspection, under palpation, percussion, auscultation, and also the vital sign related rubric also seen in this repertory than any other repertory. All the repertories are seen this type of rubrics, no doubt. But at the same time, this particular repertory, you are seeing the rich number of the related rubrics. The component of physical examination, everybody know, and not a repeat, inspection, okay, palpation, percussion, and auscultation. Then under inspection, the homeopathic practitioner is then look. Then, for example, we are collecting the signs from the tongue appearance, body language, the sleep positions, application of physical examination finding for medicine selection. There's the few cases we have discussed with you. Then tongue appearance, for just examples only, I would like to highlighting this in all the rubric, all the symptoms we are not able to discuss with you. But for examples only, we are discuss with you. Then tongue appearance maybe is an help for the selection of the medicine, and as well as the first one is the diagnosis of the disease, is help for the diagnosis of the disease, and also maybe is help for the diagnosis of an individual. That means the naming of medicine, naming of a medicine. Then body language. The body language, the patient may express his innermost feeling or emotion without uttering a word. Uttering a word. I remember the very important, eminent Dr. P.K. Bose. I remember the Bose and his commentary, his knowledge, the knowledge is sharing. When a patient is arrived near to the door, that time our P.K. Bose doctor is and prescribing medicine. That means without uttering a word. Okay, then through the body language, we are understanding the right constitution. They select the right medicine. You know, the constitution, there are two levels of constitution. One is the mental level constitution and the physical level constitution. The mental level constitutions are, again, we are divided into two. We are understanding the mental level through the temperament of the patient and as well as the personality of the patient. Okay, but physical constitution we are understand through the generals and the diathesis. The generals, the craving, aversion, thermals, etc. The diathesis, whether it is a rheumatic, the gouty, bilious, etc. Then the constitution, we are understanding the right constitution, we are understand through the body language. One of the areas is the body language. The 30% of communication occurs verbally and 65% of is occur non-verbally through the body language. That means the body constitution concept the state that the every individual has his or her unique body which react in a specific way to environmental influence. This environmental influence, due to this environmental influence, they are presenting their sign or symptom through their body language. Okay, it's a part of the constitution. It's a temperament is the real me. Everybody know temperament is the real me. Our temperament from according to our genetic material, the disposition, predisposition. Okay. Then body language, you look the gestures, we are understand through gestures, the different postures, the voice intonation, touch, then facial expression, then eye expression, then personal appearance, etc. Then we are understand the body language of the patient. That body language the correlated with the metromedica and repertory. Then a best example we have seen in our lachesis is a suspicious. That means then no eye to eye contact. Then another rubric we are majority of use in their practice dictatorial. The proud erect body stance, chin forward, leaning back with the hand behind head, resting feet on desk. While sitting, one angle is resting on other knee, while answering frequently using index finger. These are the features we are seeing. The simple look, then we are approach the case, we are able to trace out these features. Then another one, excited, excessive forward leaning, dilated pupils, the voice loud and bouncy. Inquisitive, that constantly asking questions. Then appearance, dark makeup with fluorescent colors, dressing and showy and suitable to age. Then eye expression, rubbing, always rubbing. The president of Russia, the Putin, always the Calcaria personality, the Calcaria force, lycopodium, then alumina, lactasis, platina, plumbermetal. These are the group of a few medicines. The related expression, rubbing, always rubbing. The only examples I will highlight here. Then eye expression, sleepy, drowsy. I will show you a case of antimonium tartaricum. Okay. The drowsiness we are differentiating. Always the drowsiness of antimonium tatatricum, the eyelids are very drowsy. The gelsemia, everybody know 3D and T. Then other drugs or other medicines are borax, phosphorus, plumbermet, etc. Then eyelids pulling. Then important medicines are arsenicum album, belladonna, naxomica, phosphorus, etc. Then facial expression, anxious, then frowning of forehead, aconites, ethusa, arsenicum album, borax, argentum nitricum, camphora, lacanum, veratrum. This group of medicines are shows their facial expression is like this. Then not only this group of medicine, the important medicine only highlighting. Then facial expression blank, phosphoric acid, sepia, bryonia, helleborus, veratrum album. Then the facial expression and eminent personality in America, then from disposition to the lycopodium, naxomica, camomilla, graphitis, and natrum. Is an idiotic, is like our natrum, then triangular, that is the lower part, the facial expression, Barreta carp, calcarea carp, ethusa, Barreta more, the tuberculum, etc. Then the listen here. Then not only the space we are select the remedy, but we are then suppose the subjective level symptoms are absent or the subjective level symptoms are present, but it's highlighting these group of symptoms. That means the physical examination related symptoms is an help for the right selection of a medicine. The ear pulling or tugging, this group of medicine, Barreta carp, helleborus, ignatia, lacasis, opium, petroleum sympatum, etc. Then this symptom, this sign, ear pulling and tugging, is not seen in a child. I treat a case, an emergency case, is for hypoglycemia. I'll show you that case. That case, then very first it's very unconscious, around 66 years old female. Then very first she is unconscious, but we are selected the helleborus medicine. The helleborus we are selecting the few features based, we are selected the helleborus, but after a period the patient is conscious. Then this presentation always with her the hand is the use for the pulling of your ear. These symptoms you are observed, but the patient are unconscious, we are not presenting that symptom. Okay, we'll discuss later. I will show you a case. The leg sitting, standing while, ankle lock position. You have seen the number of cases. Ignatia, you think the ignatia, natrum muriaticum, phosphoric acid. Then the fourth position, the figure 4 position, legs are crossed, anacardium, causticum, lacasis, lycopodium, naxomica. Then mouth lip compression. I'll show you a case. A child suffering from fever, the mouth lip compression. That basis we are selected medicine. The medicine act as a remedy. Anacardium, belladonna, natrum muriaticum, natrum acid, nitric acid, stramonium, sulfur, tuberculum, etc. There is another one case I will show you. This case also I show you. Mouth lip pout, always pout, is a case of an acute recurrent bronchial asthma with then fever and bronchitis a case. I'll prescribe the medicine that is based on this sign, mouth lip pout. Then antimonium crudum, ignatia, merxol, natrum muriaticum, stabisagria. Yes, the mouth lip pursuing, argentum nitricum, calcarea carp, carcinosin. This time I remember the carcinosin. All the 3 types of contradictions seen in only one medicine in our materia medica is carcinosin. Then physical level contradiction, physical, mental level contradiction, and emotional level contradictions we are seen in only one medicine in our repertory, in our materia medica, is a carcinosin. It's an gelsemium, graphitis, lycopodium, soranum, pulsatilla, and silicea. Then next we are consider the sleep positions. There is a sleeping posture, abdomen, the number of, then all the repertories we have seen this type of rubric, not only in a particular repertory, in all the repertories we are seeing the sleeping postures, abdomen on, Medorrhinum, sepia, calcarea, Placenta, acutocalcarea, the Belladonna also that shows the symptom. The sleep posture, abdomen on. Then the sleeping posture, arm under the head with arsenicum, belladonna, oculus, platina. In addition to this, very, very important drug is a pulsatilla. In my practice, then I remember a case of renal failure case. Then I select the pulsatilla is related to the position of the patient. I select the pulsatilla is a wonderful result is there. That time the acute renal failure, I remember the creatine level exceeding more than 5.5 and blood urea level goes to 100. That time I select the pulsatilla with the help of this sign, the sleep in the posture, arm under the head with, then only one rubric you are considered and finally select pulsatilla. The next day itself, that is an azotemia gradually relieved. The biochemical variation, that is a gradually the creatine and the blood urea level gradually decrease. Therefore, pulsatilla is a wonderful remedy. Then sleep position, knee chest position, then Medorrhinum, calcarea, carcinosin, etc. Then sleep posture, knee folded upward, the hand on pillow with Naxomica and Stramonium. Then sleep posture, leg crossed with Ambragracia, Beretta carp, and Bryonia. Then sleeping posture, side curling up, Hyoscyamus, Lachesis, and Naxomica. Is a sleep position, knee chest position, carcinosin, and Medorrhinum. The next, then few cases, this knowledge we are applied in my practice, the application of physical examination finding for the medicine. The majority of cases is relation between under instruction, but then simultaneously we are applied the palpation and percussion related, the individualistic knowledge we are applied in my clinical practice. Okay. Then a case that is, and first we have seen that video clipping. First I'll show you that video clipping. Is a case of glioma. Is a patient named the 76 years old a male who was residing at Villukkuri, Tamil Nadu. They came to our OPD the 8th of March 2019. It was diagnosed the case of glioma. The left thalamic is normally the site, the glioma site, who was under palliative care treatment. But after the homeopathy treatment, this patient is survived more than 1.5 years. Then under palliative care treatment, he was admitted on the same day with the trembling of whole body, especially left side, with the loss of consciousness. From casualty, he was immediately transferred to in our hospital, in our college, Sarada Krishna Homeopathy Hospital. We are setting a mini ICU. We are transferred the patient to this ICU. He had an attack of ventricular fibrillation. There is a wide complex tachycardia that time. Ventricular fibrillation is tends to ventricular VF. Then the vitals were unstable. The heart rate was that time 204. The next stage is asystole. It's an exceeding 204 beats per minute. That is why that time we are the diagnosis we are considered ventricular fibrillation. The SpO2 that time is an 85. There is an reduce. Then after neurological examination, it shows the Glasgow coma score was that time is 4. The patient was then provided with oxygen therapy. They immediately followed by assessment of blood glucose and electrolyte level. Patient was then connected to the vital monitor machine, including pulse oximetry, right tube insertion. As a part of the general rules, we are admitted in our intensive care unit. In this particular case, need patient right tube insertion and catheterization were also done. Urine input-output chart was maintained. All the vitals were monitored at a regular basis. Then considering the rubric, that time, without we are collecting any symptom or from the patient, only these features are presenting. That time we had just opened my repertory. It shows accelerated pulse above more than 140, the maximum 140 per minute. From the repertory, a single dose of the Tarantula hispanica 200 was given, then mix in 10 ml of Cordis and 10 GTT 2 hourly at around 2 p.m. But 8th March 2019, 5:40 p.m., the patient heart rate is got reduced, is uncountable. The time we are palpating through the palpation, we are countable pulse rate is at 144. And then again, we are difficulties we are facing while counting the pulse. Then SpO2 was slightly aroused. Then due to then we are given the oxygen therapy is and goes to 90 per minute. Respiratory rate 22 per minute. The trembling of patient was better. The next day, the heart was 126 beats per minute. Then SpO2 96 per minute. Then respiratory rate again slightly raised that day is at 36 per minute. Then Glasgow Coma Scale is at 5. The 10th March 2018, again the coma scale continue 5, SpO2 88, then heart rate is now 93 per minute is a normal. Not normal is below. The normal means then 60 to 100. That means then below 93, therefore I say is an normal. Okay, this chart is helpful for you. The Glasgow Coma Scale then first is then 4 but raised to 5. Then heart rate is 204, 144, 126, and finally 93. Is then the before the treatment already. Once again, I show you this video clip. Then show you. Then we do the monitor shows the heart rate is 197. But that time it shows more than it is not 95. Then that time after applying the oxygen therapy is rise to 93. The presentation is the right left side and then thinking of the muscle. This image we are considered at 0.3 separately is to be rubric. It shows the medicine. The next and the second day, the vital signs is returned to normal. The normal rhythm is maintained. But then one more symptom is developing the grinding of teeth. But the teaching, the patient, the left hand is able to rise, but the grinding of teeth is remaining. But within 2 days, then again the patient is quite normal. But again the patient is surveyed the next 1.5 years. Then another case, the female aged 31 years with a history of skin lesion on her back and under the traditional treatment since 2 weeks, presented with the puffiness of forehead, around eyes, and burning while passing urine since 4 days. She is having disturbed sleep and increased urine. It was diagnosed an acute renal failure. That time exactly is not acute renal failure, acute glomerulonephritis related to the etiology. Is an acute glomerulonephritis, and the report shows the serum blood urea slightly raised. The days is an 40, that normal value. That days is an 40 is raised to 52. The creatinine level was that time that day is 1.4 milligram per deciliter. The vitals that slightly raised the BP 136 per 90. Then pulse rate is that the 62. The temperature also there. Therefore, that time our diagnosis is acute glomerulonephritis, but it shows the sign of renal failure. It's a presentation. Look, carefully look the face of the patient is an help for the selection of the medicine. Then very first we are selected the medicine is Apis mellifica. Unfortunately, the medicine is not. The second, that look, the face only the swelling on the glabella. It's an around the eyes, the puffiness is there. But in addition to this, then the important side, the glabella in forehead, this area is swelling. The swelling of about eyes, glabella, and the forehead. Then consider swelling. Then other character generals are like natrum arch. Here select the natrum arch. Next day itself, the puffiness is reduced. Then everything is normal. The second day again we are checked the creatinine level and blood urea is come to normal. Is then very first the 52 and 1.4, then is reduced 36 and 1.1. Then my practice another an interesting case is an 18 years a female eared, the presented with abdominal pain. I said her name, I remember, is an idea, is a mild fever and chilliness with abdominal pain. The morning they took her to a local hospital and they advised for ultrasonogram. It's a clinical diagnosis that time is appendicitis. For the confirmation, they are advised in the USD. The USD not show the classical evidence of appendicitis, but maybe the probe tenderness and the dilated loop is there is the diagnosis. The clinical symptom is able to diagnose is a case of appendicitis. It was shows the linear dilatation of bowel loop around 2 centimeter size and diagnosed it was acute appendicitis. That immediately they are advised the surgery. The facility was not there, they referred it to some other hospital. But during that period, her internal examination is going. She is not, she is studying +2. They couldn't do it. Then they visited me, they saying that they need relief. That's all. The next 1 week, just a relief is there. After the examination, again, we are doing the surgery. They're willing for the surgery. Whether we could do it or not is a question that rises. When I went to the examination table, then for the confirmation for the clinical diagnosis, I went to the examination table. He was lying and here she is presenting these features. The look, this video clipping. Then she is flexing her right leg. For the why I ask a question, why you are flexing your left right leg? That she say that time the right the pain relief. Then I found severe sensitiveness. Then also for the confirmation, I asked the patient, please flex your left leg. But she that time is an just extension of left leg. But again, the flexion of the left knee, again pain aggravated. But the right leg, the flexion ameliorate the complaint. The left one, the extension only relieve the pain. Then again, during the examination, she was so chill, and she was asked it to me to switch off the fan. These are 2 symptoms only we are collecting from the case. And going through this repertory, there is a rubric typhlitis, otherwise called it appendicitis, deep circumscribed swelling, lies on back with the right knee drawn up. Only one medicine is there, is a Heparsal. I was prescribed that time Heparsal 200, advised them to take 1 dose today and the next in the morning if the pain is persists. I also advised them to, if not relieve the pain, then only one option is a surgery. But the next day itself, then her fever and everything is subside. Then the pain around 99% the pain is relieved. Then within 2 days, again I advise another ultrasonogram is and shows there is no any dilated loops. As an repertory, intestine, appendicitis, the number of rubric is there. Then out of this, then Heparsal, typhlitis, deep circumscribed swelling, lies on back with the right knee drawn up. It's a characteristic physical examination finding. Never neglect this type of symptoms. By the physical examination, McBurney's point, then very sensitive is indication the diagnosis of the appendicitis. But the same time, a homeopathy doctor, not only the concentrated for the diagnosis, the same time you look all these features, these type of features may be help for the selection of the right medicine. Is sent to lab report within 1 or 3 days interval we are taking. Then all the inflammatory sign is and subside in the second scan report. Then another case, the male child age 18 months having a past history of UTI. Is my practice and a wonderful case. I believe in our science. Once again, I say our science is a scientific one. I'll show you why I say our system is a scientific science. The presented with the left-sided inguinal hernia is a small, the like our then a story. This the patient bystander says a story. The patient was admitted in the hospital and advised for the surgery, but they were not like willing. But they are not. The parents are not willing for the surgery. A reason behind it. His father was suffering from anal fistula, and he underwent surgery 4 times, but again and again repeat the same complaint. And finally, then our system, the homeopathy system, helped for the patient. Then he, after the homeopathy medicine, the complete the cure takes place. So he want to his son to he is treated by homeopathy. They came here. They wanted to know whether we can do anything or not. They wanted to know whether we can do anything or not. Then when he took the case, we noticed that the patient was always keeping his leg flexed. I asked about it. That time the mother said, he feels better when he knees his leg flex. I'll show these video clippings and help you to understand the modality or the presentation, the physical side. The scrotal sac, the left scrotal sac, then objective level symptom is presenting the child flex her knees. Okay, inguinal region, there is a child infant, left side, better thigh flex on abdomen, worse on pressure.
Infant in the age group.
Okay, then very extensive, then abdominal content through the scrotal sac, the chance of strangulation, therefore they are immediately advised the surgery. Okay, then the next video clipping should show you the result. And almost the 98% the swelling is disappeared within 3 days. But at my surprise, then patient returned the normal vigil. Then I could cure establish the patient has returned the normal vigil. It's also in this case. But at my surprise, after 1 week, the child presented with a boil on his scalp, but we didn't prescribe anything. Then just again I wait for the case. Then it was healed after 1 week and left a bald patch. That time our diagnosis patchy alopecia. Then also another surprise, this child is always suffering from recurrent attack of upper respiratory tract infection, allergic upper respiratory tract infection. After this treatment, he was completely relieved of that recurrent attack. The latter is alopecia is also got ameliorated. That this case was wonderfully cured with this particular sign, particular physical examination finding. Then 2 drugs in here we are comparing. The one is the Naxomica and second one is the Tuja. Then Naxomica, inguinal hernia, left side, irreducible by a skillful manipulation. Then already conveyed with you, Tuja. The so many literature is related to Tuja, is related to hernia, especially in pregnant women after delivery. Is that hernia is there, is that medicine is used, the Tuja is used. Is then follow up, only 1 or 2 doses of medicine is given. Then listen here. This picture is helpful for you. Then complete the swelling is disappear. After that, developing a baldness, then alopecia. It's a boil associated followed by patchy alopecia. After the 2 weeks, is an that time we are able to say the complete cure. Then higher important organ to less important organ. Then innermost, the central to periphery. Then another case, a 90 years old woman presented with the fever with chilliness The since 12 days along with the cough, the white is yellow expectoration. Actually, her chronic complaint is this one, then chronic bronchitis. But now that during this period, her presentation is severe stitching pain and ulcer-like eruption and edema on the left leg. That is at that time the diagnosis is cellulitis. The cellulitis, everybody know, is a subcutaneous level inflammation. There is no any lymph node enlargement. There is not acute presentation, or is not acute presentation of cellulitis. The acute presentation of cellulitis, the erysipelas. But asking the question, while questioning, the patient says, before around 4 days back, the presentation of erysipelas. The erysipelas is considered as acute of cellulitis. Then clearly we are able to differentiate it. Cellulitis always diffuse in nature, but erysipelas, the regular border is there, border is elevated. It's a high rise of temperature is 101, the sometimes is extended to 103. The mild ronche, the most valuable objective level symptom here, constantly chewing by patient. Look the video. Our narrating the system is the movement please consider there what is the bryonia that is but first time we are trying with bryonia. Unfortunately, bryonia is not working. Then we are prescribing the phosphorus. The wonderful result is there. The swelling is reduced. Then the G movement is changed. The patient absolutely normal. The bryonia is first we are prescribed the rise to bryonia 1 up, but unfortunately the bryonia is not working. Then next we are changed to phosphorus. So phosphorus shows the wonderful result. This is an importance of the physical level. While physical examination, we are consider all these things. Then another case, a 16 years old male presented with a complaint of cramping type of pain over right iliac region since 3 days. The pain get aggravated during the pressure while passing urine and relieved by flexing her right leg into the chest. On examination, the McBurney sign, the reverse signs are positive. Then again is a second case of our Hepar cell. I show you this video clipping, the first, the same feature. I'll show you a girl. Again, the present in the same features. Okay, in both cases, we are trying with the Hepar cell. The Hepar cell is a wonderful result. In this case, also within hours, the result is there. Abdomen, intestine, cecum, typhlitis, deep circumscribed swelling, lies on back with the right knee drawn up. Then, this presentation is like this.
ഈ നേരത്തെയും ഇങ്ങനെ തന്നെയാണോ ഈ ഇങ്ങനെ കാല് മടക്കി വെച്ച് കഴിഞ്ഞാൽ ആശ്വാസം?
And to within few days attend to different ultrasonography. Then a subacute appendicitis, they are diagnosed the proper tenderness and dilated loops and a slight inflammatory fluid there, diagnosed as appendicitis. Exactly within ultrasonograph, the 100% we are not able to work out appendicitis, but the related finding and finally clinical diagnosis there we are say appendicitis. The next one, then within 3 days, then everything normal. Then say then recovery and cure. The recovery means and after the period only the patient the relief the effect from the complaint. But while cure established, the within that period, never is extend the convalescent period. Already I convey with you the 6 qualities of an acute cure. Then another case, a 5-year-old female. The time is very short. Within 10 minutes, I will wind up this program. Then 5 years old, a female, the child having a history of childhood asthma and inguinal hernia. The continuous fever, even in 5 days, cough with the shortness of breath. I'll show you a case. Yes, it's a case of a male child. As and I'll show you the drooping of eyelid of antimonium tartarica. This case actually then from after the allopathic consultation, a course of allopathic treatment, but the patient is not improved. The diagnosis is a pneumonia case. In clinical presentation, that time the video clipping is helpful. That time his presentation helped for the selection of anti-pneumonia tartaric. The eyelids, the drooping eyelid, very barky cough, veins are there, the short, then suppressed expectoration, dry cough, also very drowsy. This eyelid drooping is with the help of this sign, they select the medicine. Next day, the child is improved. Very happy. Is very happy. The return to normal vigil. He's been to laugh. The playing start to play. Bronchopneumonia. In children, the bronchopneumonia is quite deep. The difficulties we are facing. Quite. Then we are comparing the lobar and the lobular bronchopneumonia. The bronchopneumonia is a little. Sometimes it makes some complication. Therefore, carefully treated the bronchopneumonias. Then children's is common the bronchopneumonia. That because in bronchopneumonia the edema is developing bronchial tree. That time what happened? The air is not the normal sufficient of air is not reaching our alveoli. The internal respiration is not happened. Okay. Then 3 drugs we have remember: gelsemium, opium, and nus mosquita. The gelsemium, 3-DNT, opium, dullness of head, stupor, inclination to sleep without being able to do so. Then nus mosquita, stupor and insensibility. Then another case, 23 years old, a female presented with a complaint of profuse menses, dark clotted with lower abdominal pain. She also having pain in lower extremities, more in legs. During the pain, she used it to constantly presenting her feet. As in a case, she's using the painkillers, but it's not relief. It's basically a medical, under medical profession, medical doctor, then presenting this side.
എപ്പോഴും കാല് ഇങ്ങനെ പിടിച്ചോണ്ടിരിക്കണം. നല്ല വേദന.
Within short period that ago, that is the doctor is quite normal. The pain is relieved. Then another case, the 70 years old lady that came to the hospital and admitted to the casualty. The 2019 around 10 a.m. She was unconscious at that time with the swaying of hands, vomiting and frothy salivation. On inquiring, bystanders told that she was anxious and restless yesterday. On inspection, she is having staring look and sweating all over the body. On examination, the pulse and BP were imperceptible. On investigation, RBS only 39, it's hypoglycemia. Then patient on unconscious and then SpO2 only 57. Then our medicine Hellebores help for this case. But we are admitted in our ICU. The mind staring, thoughtless, then free movement of
എഴിക്കണോ എഴിക്കണോ
is absolutely normal. Is an Hellebores with the supplementation of then IV, then 10% IV fluid also given to maintain the condition. Then another case of pancreatitis. A 35 years old female presented with the pain over right hypochondriac region since 5 days. The patient was moving her lower limb to and fro and holding it up and attempt to lessen her pain. The presentation is like this. Please. The severe pain here effects from
വീണ്ടും
the pancreatitis. The presentation is like this. After a few moments, again is sitting and for the relief of the pain, must bend and draw up right with her hand, and after moving it to and fro, she can rise. Again rise. After walking a few steps, the pain ceases. Only one medicine in our repertoire is a lycopodium. Let my surprise. Then after 1 hour after lycopodium, the patient then feels better feeling. This lycopodium again acts as a training level. Now the patient is free from the recurrent attack of pancreatitis. Then now the sugar level also is under control. It's an action. Then another case, a 14 years old boy presented with a dyspnea within childhood. Then he has also had a chest deformity, the pectus carinatum, the structural changes is there, but in bronchial asthma, is at that time only photo is available, but the chest deformities and almost is corrected with the help of medicine. Then another case, the ulceration of palate. The position of this ulcer is helpful to select the right remedy, phosphorus. Then rubric is like this: ulceration, soft, appear torn above the uvula, about 1.5 inch in length. Only one medicine, phosphorus. At the same time, you are consider other medicines, ulcers or soft palate, then lacusis, mercur, and sanguinaria. 3 drugs also keep in your mind: lacusis, mercur, and sanguinaria. Then gradually the ulcer is disappear. It's a case of rhododendron. It's a case of hydrocele. Then individual diagnosis, the main medicine is rhododendron. Then testicle hydrocele birth from right side in a child. The other 3 drugs also keep in your mind: Oramet, calcarea carb, and Calimuretica. Then another an interesting case is in first time I used this repertoire, the nerve repertoire. The case history is like this: a 40 years old man, alcoholic, and also is a chronic smoker and a hypertensive patient, presented with an ulcer in 1 month duration on the dorsum of left foot. Is actually this patient is the brother of one of our staff, and the first he was not willing to get admitted in our hospital, in our IPD. But on compulsion by the sister, that is our staff, he was convinced. Then that time we are prescribed bryonia. Then 3-hour interval I prescribed bryonia, but he doesn't show any improvement till then, and the temperature become rise to 104.2. Then the sister asked me, "Sir, there is any need of refer?" I told her that we will try and then study once again the case. On examination, I found that the patient show sweating only on chest, and also the temperature or not 4. Then I referred the nerve repertoire and found that the rubric, the temperature increase in septicemia 104. The contain only one remedy, it is salicylic acid. Then after reading Materia Medica, we saw that his sweat is also found in that. Then while watching the patient with the help of the towel, always he is wiping the area of the chest. What is the common in males? While sweating, we are wiping that area. We are neglected the symptom. But going through the features, I will show you that time. Then lab report, ESR is raised, is 65. The look, the temperature chart, that period is rise to 103, 104, 104.4, 104.4. Then is gradually reduced. Around 3 o'clock, I prescribed salicylic acid. Fever 104 in septicemia. The listen, this particular repertoire we are seeing the number of rubric related to the temperature chart. 101, 102 in tetanus after a burn, 104.4, 104 to 105 in diphtheria, then 105 in septic fever, salicylic acid, 105 in polyarthritis rheumatica, etc. Then another case of undiagnosed and ulcer is an picture is only I see you, the time is very short. These are the epithelioma. It's a diagnosed a case of undiagnosed, but later is a diagnosed an epithelioma. Then position of this ulcer and the character of the ulcer is helpful to selection of the right remedy. Is an Kali sulf here prescribed. Then ulcer, epithelioma on right, extending from, the site is very important, extending from lower eyelid to alanaceae, ulcerating state, indurated base, wall-like hard, elevated edges. Is we able to select the medicine. It's an Kali sulf. It's a wonderful result. So another case of eczema. The site is helpful to work out the medicine. This case, this raw flesh-like appearance, especially action on the elbow joints. Only one medicine in our repertory is a chamomilla. Chamomilla helpful to cure this case. Okay. Then another case for hemoptysis, they have prescribed the cryosotum. That case I prescribed, the reason is that during the after vomiting of the anamnesis, the constant moaning and gasping of air. One more drug, keep it in your mind, is belladonna. In case of children's, the belladonna, the sitting erect posture is ameliorate the complaint, but then antimonium tartaricum also the same position, the sitting erect posture. But the moaning, the constant moaning, the end of inspiration, the only one medicine in our materia medica is belladonna. But in this case, we are prescribed. Then other few features based, we are prescribed cryosotum, weakness, extremities are cold to touch, etc. We are prescribed cryosotum. It's a wonderful medicine. Wonderful medicine is helpful to cure the condition. Other medicines are magnesium mercosol and phytolacca. Then another case of the, listen here. I will show you the body language is based on antimonium fluidum. It's a case. Here select the antimonium fluidum. It's a case of bronchitis. It's a child within days, within second day itself, the girl is itself returned to normal. That is an uncommon peculiar characteristic and also disappear. Then not only the generals are improved, even the first changes happen, the uncommon peculiar characteristic feature. Therefore, our master says, even a characteristic particular also considered as uncommon peculiar characteristic symptom. That characteristic symptoms are disappear is considered as general improvement. Is another case of fever. It's a pulsate law. The looking, the constantly, the face, the lip leaking. You can help for the selection of the pulsate. But the medicine is the right one within short period. The result is the next day, the girl begins to laugh. Very active. Okay, the fever, leaking, they are considered 3 medicine: natrum carb, stramonium, lycopodium. Then another case of opium. The look, the mouth motion, the movement, the tongue constant. There is a history of an always child dependent mother, and related to her his studies, then on problem arising with his mother, and mental the studies at that time. His opium we are selected as considered mental state of the child. We are selected the opium. The presentation is like this: motion constantly with one medicine, opium. And yesterday He is very active. Within short minutes, the result is there. That is an activity that selecting the right medicine, that medicine acts as a remedy. Medicine acts as a remedy, definitely it will happen within short period. And 3 drugs, 4 drugs we have considered. The movement inside, the tongue movement inside, Helleborus, opium, aconite, and stramonium. A case of sinusitis with the bronchitis is another very interesting case. He is always carrying a kerchief with the ice water. It's a presentation. Then I ask a question, why he is carrying this kerchief? The mother says, always the cold water, they dip in the cold water and applied this the cold water over the ice. This help for the selection of the medicine. Is that wonderful?
ഇപ്പൊ നനച്ചു കൊടുത്തതാ
Prescribing the pulsation.
ദൂരെ നനവ് കുറഞ്ഞു തോന്നിയാ പിന്നെ പിന്നെ കിടന്ന് കരച്ചിലോ ഇതെടുത്ത് കണ്ണിൽ വെച്ചിങ്ങനെ ഒപ്പി ഒപ്പി
ഇന്നലെ മുതൽ തുടങ്ങിയതാ.
Then after that, he is absolutely normal. The return to normal vigil, that is the first, the characteristic symptoms are disappear. The generals have improved. Is another an interesting case. Is a case of ECG shows then supraventricular tachycardia. Supraventricular tachycardia is an rubric you are considered chest pulse accelerated fast frequent more than 200 per minute. The listen is the page of that particular our repertory. The number of rubric is related to heart rate or 200 chininum hours. Chininum hours after hour, after 1 or 2 hours, the patient, the supraventricular rhythm is come to normal. Okay. It's a medicinal management. It's chininum hours, the 32 dose. Listen, this patient only half size, only the swell artic area. After the treatment, are considered this medicine. Then another case of vertigo is a muriatic acid. Time is almost over. This another interesting case. Then constant eructation. That time he is with the help of right hand press the left hand. It's a pressure amelioration. You are considered the sulfur. It's a wonderful result. It's a case of bronchopneumonia. The look here is, and we have prescribed the internal, the discharge on the kante, the yellowish discharge. It's very drowsy.
എന്തെങ്കിലും ആഹാരം കഴിച്ചോ മോള്?
ഇന്നലെ രാത്രി കഴിച്ച സർവീസ് രാവിലെ ഒരു ശർക്കര അര
these characteristic signs in yellowish discharge
കംപ്ലീറ്റ് ഒട്ടി പിടിച്ചിരിക്കുകയാണ്.
the medicine euphrasia. The next day itself the child is normal. Euphrasia pulsatilla phosphorus. It's another interesting case. The same inguinal hernia. The presentation is an help. The tuja is help for you. The correct the situation. In this case, the surgeon advised the surgery, craniotomy then advised, but later, then after the second consultation, he says after homeopathic treatment, he says no obvious swelling, therefore they are not recommended surgery. Just again their weights. Then Naxomika and Tuja, we are already conveyed with you. It's a case of sublingual cyst. The region is held for mouth swelling, tongue under natrum muriatica. Then percussion finding, the number of rubric, the correlate we are seen in our repertory. Palpation related finding, the inner chest lung auscultation sound, vocal fremitus increase, only one medicine sulfur. Then chest and lung pleura inflammation, vocal fremitus is absent with the plastic exudation, medicine heparin sulf. The chest percussion sound, dull sound over the large surface of the area, heparin sulf. Inner chest and lung percussion sound, normal resonance on left side, and 1-2, that is the bronchial and vesicular catarrh in Copaiva. The percussion sound dull, 3 medicine kali cyanaticum, then kali iodide and sulfur. The listen, this rubric you are carefully read as a board from apex to axillary border of petralis major in front and to middle of the scapula behind. Emphasis arsenic iodide. That means a skillful homeopathy doctor only the right way we are conducting physical examination. That means a doctor, a homeopathy doctor, a thorough knowledge about applied anatomy, surface anatomy, radiological anatomy, surgical anatomy, then that time only we are right way we are able to conduct the physical examination. That means the dull as a board apex to axillary border of the petralis major. That means we must aware about petralis major origin and insertion, must be aware about it. Then dull over the lower half of the right in asthma. The another scilla, dull circle size palm on hands. Dull in left clavicle sanguinaria. Then auscultation finding the correlated with the disease and the medicinal selection. Rubric 1 auscultation finding lung auscultation, sound egophony, right side tuberous upper part. Then added sound egophony, whispering, patrolling. Then related medicine is there in our rubric is there. Lung auscultation, sound egophony in pneumonia. Only one medicine. Proving, reproving, verification, verified medicine is a Synga metallica. Auscultation, sound amphoric in tuberculosis, natrum ars. Auscultation sound, one of the epis audibly disease, the tuberculinum. Auscultation sound is a bronchial. Then just sternum pain, murmur upward from each side, nanurism, spigilla. Number of murmur related rubric we are seen in this repertory. Okay, then finally, not in any means to be considered as an end, but only the means to similima. That means it's only one part. There's so many cases, if an imbecile patient, if a deaf and dumb patient, the subjective level symptoms are absent, then subjective level symptoms are not showing the characteristic modality, concomitant, etc. At that time, just we are considered these physical examination related finding. That means that objective level symptoms. Once again, I extend my sincere thanks to all for this this time. Thank you. Any doubt or any clarification need, please ask. Otherwise, the time is now 9 and 10. Therefore, there's so many difficulties we are facing our participants. Okay. Or a chatting or anything, then any doubt, please. Okay. I hope there is no any doubt.
Thank you, sir. There are some questions also coming up.
Yes, please, sir. Please ask your question.
One question is, sir, they are asking about the repertory, sir. I think it is nurse, right?
Yes, nurse repertory.
Nurse repertory, okay, predominantly. Okay, and then
so many repertories related, then physical examination related rubric is there, but the commonly we are seeing the physical examination related inspection, palpation, percussion, auscultation related rubric we are more we are seeing in this repertory, the nurse repertory.
Nurse repertory, okay.
Then reversed edition of Shivaramakrishnan is the methodology like our Indian method isn't too much help for you.
Okay.
It is a very easy one.
Okay, sir.
Okay.
Another question is, how confidently we can depend upon the single remedy rubrics that one student has asked this question. Single remedy rubrics.
That's because the reason is then these particular repertory, this particular rubric, the majority of symptoms are well-proved symptoms. Proved, verification, re-verification, and clinically verified symptoms only included. It's an advantage of this repertory, the hearing-aiding symptom. Almost all the symptoms are from the hearing-aiding symptom. That is very, very important. We are believe 100% we are able to believe that definitely the sign is there. We are able to select the right medicine in right minimum dose. That minimum dose is result is there, no doubt.
Yes, sir.
Yes.
Another question: how long you waited between two remedies?
Sir, in my case, then I know then the result is our medicine selection is the right one. That definitely resulted within the short period.
Yes.
Therefore, after a period, again the patient shows the sign of again need of the second dose of medicine. That time only we are repeat the case. we are not only stick on a single dose of medicine. Some cases we are needed the second dose or a third dose is needed. That time we are prescribed. The minimum dose means the least quantity of medicine to enhance the vital power. That means even a single dose is not a minimum dose, but we are not able to prescribe the frequently 3 hourly. We are not able to prescribe. But if you need the next dose of medicine is given, it's the method that following.
Yes, sir. There is a lot of appreciation for you. I can see only thank you, and so many things.
Okay, thank you, sir.
One simple question also is asked. I think it's why not 50 millisimal potency?
Yes, sir. In my practice, also use 50 millisimal scale of potency. There is no any restriction, centisimal or 50 millisimal, 50 millisimal scale of potency are used. In my personal experience, in skin complaints and very sensitive, the hypersensitive patients, we are using the 50 millisimal scale of potency. But the advantage of 50 millisimal scale of potency, the end of the case will cure that time only they are producing the homeopathy aggravation. That is an advantage of 50 millisimal scale of potency. Therefore, their homeopaths are widely used the 50 millisimal scale of potency. But while using the centisimal scale of potency, maybe even a single dose is producing unwanted aggravation. Therefore, our master is an invented this 50 millisimal scale of potency. Then while reaching the cure, that time only is producing a homeopathy aggravation. There is an advantage of 50 millisimal scale of potency.
Yes, sir. There's one good question, but anyway, that's a different disease what you have presented. That is bronchitis you presented. She asked a question, difference between lip pout and lip pursing in body language. I think she's confused with emphysema.
Lip licking means like this with the help of tongue. Always the dryness is there, lips the lipping. The pouting is then just your difference is there, lip pouting.
Yeah. She asked about lip pursing. Lip pursing.
Pursing means in COPD, you have heard about the pursed lips. That breath is like this. The close the mouth like a purse sleep like this. There is a pursing. But licking means like a podium. Then always that just with the tongue is touch on the lips. Okay. If the dryness is there for the moistening, they licking the lips.
Yes, sir. Yes, sir. I think there is no more. One Dr.
Thank you, sir.
is asking your number.
It's my number 944 23 65 199. I repeat 944 23 65 199.
Yes, sir. Thank you so much, sir. When the session started, it was like unifying the 3 basic concepts of homeopathy. We have seen the art of physical examination of practice of medicine to Hahnemannian principles through organ of medicine and also through repertory. It was so nice of you that you highlighted on the repertory. It was a profoundly authentic and genuine hard work that we could see, because every case has been a very organized way you have presented, and also there is a lot of record maintained. That is a very good inspiration for most of the youngsters who are actually watching this. Many a times we do this one, but people lack with the organized records that is very much required for the future of homeopathy. And one more thing I felt is your presentation for me, I felt like a classical album of homeopathic accurate observation, physiognomy, and also physical examination. As one of my students also pointed out, a wonderful observation. All the observations you have utilized it for the repertorization. That's a great thing, sir. So we are extremely thankful to you, sir, for having you with us on this day.
Yes, sir.
Even though the time exceeded, no one was bored. Everybody was happy. Some are telling that please continue, sir. So that is a good expression from the student fraternity also. So a profound thanks from my side and also from the management side and also from the team ProVision to you, sir. Over to Dr. Ashik.
Okay. So as we have come to the end of today's live and lively webinar session, I would like to thank the management of Father Muller Homeopathic Medical College for this webinar session. I would like to extend a sincere thanks to today's spokesperson, Dr. T. Ajayan, for the informative and thought-provoking session on utility of physical examination in rational healing. and also clearing most of the doubts. I would like to thank Dr. Rajachandra for moderating the session. I appreciate the team ProVision headed by Dr. Dheeraj Fernandez for their sincere hard work to make this program a successful one. I extend heartfelt thanks to all the participants of today's session, webinar session for making the session active and lively with our chats full of doubts and also with the participation. Thank you all. Finally, I would like to conclude by saying that this is not the end. Tomorrow we have an interesting session by Nicola Coutinho at 7:30 p.m. on the topic psoriasis, homeopathic approach and management. Stay tuned to our Zoom ID. Good night. This is Dr. Ashik Muhammad signing off. Thank you.